So today I will try to pronounce your name in Portuguese. It's like Cristina Vaz de Almeida, no?
Almost. Cristina Vaz de Almeida. Yes.
Okay, it's not easy to pronounce your name
Yeah.
in Portuguese, but I did my best, and we are honored to host the president of Portuguese Society for Health Literacy, and of course you have so many titles. It's confusing how to sign you, but the best way is to stick to the major one for this
Yes,
interview.
yes, of course. President of Portuguese Society of Health Literacy is the
So
one.
thank you for your time.
Of course. It's a pleasure, Sasha.
And yes, so we are going to straight to the important question. The first will be, what are the main obstacles preventing health literacy from becoming a central priority in European public policies?
We can see that the main obstacles is the competences that people must have to deal with the complex system of health. Because more or less 50% of the European people doesn't have the level of health literacy to access, understand, and use the health resources. If they don't access, there is a lack of, it brings inequalities, and it brings problems of not only economic problems, geographical, social, and inequalities are increasing when people have a low level of health literacy. If people doesn't understand, they cannot do safe decisions. And the obstacles are not only social, because economics has a great intensity, I can say, level in the health literacy level, and not only the socio-economic problems, but also the education problems, because you can have people with license in a high degree, but if people doesn't work in society, doesn't deal with the real problems in society, they cannot deal with his own health. So it's not a question of social, educational, cultural, but also the context where people live. This is the
How
main
can
problem.
health literacy concretely reduce inequalities in access to healthcare across Europe?
If you know how to access the health services, if you know how to deal with your lifestyles, not addictions, not making exercise, a good nutrition, you take decisions to have a healthy life. And if you don't assess, if you don't understand how to do it, this is compromise. Not only your health, but health of the group, your family, and communities. For example, in the hesitation of vaccination, we have groups of people that don't vaccinate. This is quite a huge problem in Europe, and increase several diseases that were controlled. So people must do sound decisions with competencies. And economic profile influences, because when people doesn't have money to buy to go to the medical doctor, or doesn't have money to increase the level of health, and people work and just to survive, the other level of well-being are decreasing. So we must increase the level of well-being in a way of integrate all society. And health literacy is human rights. When you talk about health literacy, you are talking about human rights. It's a right, the right to have health, the right to have a good food in table, the right to have a good healthcare services.
How hard is your task? I mean, and what was the most important project that really could make that change?
We have several projects along the life cycling, just for kids, for adolescents, We make a lot of interventions in schools to increase the level of capacitation of children and adolescents to decide for their health. For example, digital health, the sleep, the food, the exercise, the diseases, for example, cancer, sexual diseases like HIV or AIDS, and if the children and adolescents know better how to defend themselves, they could bring a better life. And we have also for adults and for elder people, we have programs according to conditions. For example, we have a very good program for migrants because we have a very huge group of migrants in Portugal. And sometimes some migrants don't have the access to healthcare services because they are afraid to be deported. They are afraid, they don't go because they work a lot. So this program, Acolher, is a program of empowerment of these migrant people. And we make, for example, empowerment of women about domestic violence, about to take care of the children, about to take care of ourselves in terms of healthcare. Something sometimes very easier to do it. How's your food? How was your nutrition today? Can you change for a little bit? Because even we know that some people who comes from other countries, when they arrive to Europe, they like to eat fast food, for example, because it's not expensive, and this increase the level of obesity, and the obesity is a disease. So to give power to people, this program Acolher is a program for health and well-being, and was considered by Alexandre Patoué, is a member of the Refugee Forum, as one of the best programs in Europe for migrants. So this make us proud of it. But we have several programs. For example, From Steps to Hugs is a program for elder people with cancer, physical activity for elder people with cancer. We make also research. We make a systematic review, and we see that even people with cancer and elder people must do exercise, must. So we organize a program in networking. We are very good in networking around the communities, municipalities, the academic, the patient associations. We have more than 60 patient associations working with us, and this is quite good. We don't do anything alone. We must do everything together. And this is health literacy.
So basically, you have a good result, and other organizations could recognize your results. And what is happening when you collaborate with them? Do they have the similar results in their own location?
We work with a huge group of entities, not only public one, but private one, non-profit organization, patient associations, academic associations, students associations. We have, for example, the youth voices, the voices from the youth. It's a program with young people that are leaders in their communities and their schools, and we profit these young persons to increase the level of understanding of health. This is when we work with people based on health literacy, all the results are good. We increase the level of evaluation. We evaluate our interventions, and in schools, with children, with elder people, we have these mini assemblies of health. We give voice to the people to hear what they want from life, what they want for their health. And when you give voice to people, you empower people. And this is quite a huge moment, because I am present in all the mini assemblies. I am coordinating almost all, and we see the people, how happy they are. Even they are children, even they are adolescents. They want to give their voice. And what we doing is organize with the municipalities what will be the opportunity to increase and to implement some of these agreements and that people give to us in schools.
So basically, you have approach to every age category, but the most important is education to young ones, to students and scholar kids. And is there any kind of different kind of approach to those kind of age youth? I mean, because they are most of the time they are spending on the social media and TikTok, Instagram, and more. So, what is the bridge between your wish and your goal as an organization and those young people?
You must adapt the communication to the life cycle. You don't speak the same language with children or adolescents to elder people. So we adapt language. We are experts on the adaptation of language, the plain language, to each segment, and you must increase the level of understanding to be protect against disinformation, because you know that through TikTok and through social networks, there are a lot of disinformation. My opinion is that healthcare information must be appealing, attractive as the disinformation is. So we must be attractive when we speak about health, and this is the point, because generally health is very complex, and if you turn the language of health appeal, people will understand and will substitute the disinformation appeal to the credible information. And this is our work. Turn the language of communication adapted to each segment, but at the same time to work with the reason and emotions. Not only the rational serves, you must put emotion to transform. And that's the trigger to change a little bit what is disinformation. Because if you turn the health communication appeal, you can put this information, substitute the disinformation language and the uncredible and the danger that disinformation brings to every people, especially for the youngest.
So your organization did a lot for Portugal citizens, and when we are talking about Europe, what European laws need to change to make that difference, and how can you influence those policymakers or lawmakers?
I am participating in public policies of health literacy with the Directorate of Health and the Council of Health. I am consultant, so I bring my expertise and the expertise of all the experts of health literacy, because I'm also the director of the postgraduate course of health literacy, the only course in Portugal that trains experts on health literacy, and is very proud since 2012 as advanced training, and from 2016 a postgraduate course. So this is the only course in Portugal that trains several hundreds of experts on health literacy. And we bring to the communities, we bring to the public policies this knowledge and this transformation of interventions. And we have seen a lot of results. We are a very respected scientific society. We are very respected. People hear from us and invite us. All weeks I have a conference or a speech or a program to influence others. So we must be good influencers of health and health literacy. And at the European level, we have a position for example, in an Horizon program. We are the leader of Work Package 5 to quality criterion for digital platforms of information about cancer to cancer patients and caregivers. And this is a huge achievement to Europe, because we organize through research, through systematic review, to focus group, to survey, to Delphi panel, the quality criterion that digital platforms with information about cancer must have. And this is a huge step in the quality of the information and the combat to disinformation. But we need people like you, Saša, and your ICG to organize together more to deal with this problem, this infodemia that is the risks for health and well-being, that not to understand, not to access, not to use the correct information could bring to societies.
So there is concrete progress in approving the health of EU citizens. And I know, because I was reporting from Germany, and it was like big issue about the lack of medical staff. And I know that European countries, not just Germany, have the similar problem. How can we solve in the future that kind of problem? So how can we create more medical staff in Europe?
We don't have a problem of medical staff. We have a good medical staff and nursing. The question is how they work in the communities, in public services and private services. It is more a question of organization than the lack of. Sometimes we have the lack of nurses or psychologists, but we have, in Portugal, we are 10 million, and we have the number of doctors and nurses and psychologists are good for this population. But sometimes the organization of the system must be realized. And that's why our president now, with Professor Adalberto Campos Fernandes, are working on this mindset and this strategy to think what will be the next steps for these questions about the organization of the healthcare system.
And what would be like long-term goal for Portugal, and what will be the long-term goal for Europe in this kind of actions?
You know that not only Portugal but Europe, we have, it's an elder country. More than 25% of the people have more than 65 years old. So we are dealing with geriatric countries. And this brings other problems, not only for longevity, this is good, longevity, but not only longevity without health is not good. The question is, after the 65 years old, people in Portugal lives well, more or less 6 years, and then they have multimorbidities, several diseases, and this is a very strong burden for the society. And we must deal with this. So the long term is to look to the longevity of people, to profit these more elder people to contribute to better societies, but you must change not only people, but also, for example, healthy cities, the space that where people lives, the frails that we have in the cities are very high with the elder people inside the houses. So we must organize communities and society and buildings and parks to receive this increasing level of longevity that people have. And this is a question of social determinants of health, the structure, the buildings, the streets, the parks. What are we going to do with millions and millions of people that finalize their life, work life? What they are going to do? We must, because we are occupational human beings. We need occupation. And if you don't occupy these people and people remains at home, solitude brings dementia. Solitude brings dementia and other problems, depression. So we must look to the bottom of this tunnel and say, okay, we are going in some years, a lot of people, enough of people to be elder people. What can we do about this? This is a good opportunity.
So basically, the first thing that we need to know as citizens is self-awareness and self-care in a way. But also, I always say in journalism, only united we can make that change. So who can be involved? Who can you call to action? I mean, what kind of organizations or individuals to bring together to make that change?
We are doing now the call to action to everybody, because you must, as I say first, we don't work alone. So you must put the government, the municipalities, the regulators, the media is quite important, the media, but to construct a positive construction of well-being. It miss this part very to see the constructive part of the achievements of the societies, not only the deaths and the problems, the achievements of societies, to increase the level of proud of society and the proud to be human. And you must also make the academics, the schools, the scientific societies, the professional orders, the patient association, the parents association, you have the sports association. So you must increase the level of networking between all these stakeholders, because some of them could bring different things, but together with a strategic vision, we will increase the level of participation. Because if you don't put the stakeholder in the wheel, he will not participate. So this is a wheel where everybody must be and to make their part. If you do your part, we will increase the level of results.
So, as a society, where are we heading? Are we heading in a good direction, or we are falling down in a way? I mean, all people don't have time because they are busy with their kids, with their jobs. I mean, the prevention is not on a good level, and people don't have time. I mean, they are saying that they need massage when they feel the pain. They're not thinking about the massage in a preventing way. So, where are we heading? Can we change that really?
Yes, you know that positive thinking and optimism is a good way to show people. We have the nudge book from Talen and Sunstein. They say that nudge, we must increase the opportunities to people to know, okay, you can do this and this and this, what you choose. So this is an ongoing work. It's not easier, but if you don't do it, you are going to be look into the air. No, we must be activated and be activators. And Portuguese Society of Health Literacy is a great activator of minds and for responses. We have a huge activities, level of activities, because when we deal with people, with organizations, when we propose, people say, okay, it's good for us, it's good for us. So we must increase this level of participation, and this is quite an ongoing work that we are going to achieve step by step. But at the end, I think the results will be better than before. You don't have to change the world, but you must change something.
How can we make that public call? I mean, people are going to see our interview, and some of them really, I know, I can feel that they want to participate and to be involved. How can they reach you, and how can
Mhm.
we can make that public call? Where to go? I mean, on your website or your social media,
I
what is the
am
best way?
I am always available if I don't have a conference or a meeting, but I have a group that is always available. Portuguese Society of Health Literacy is open to discuss, to debate, and to see the path to achieve some results. Even the result is well-being or health prevention, health promotion, disease prevention, diseases, increase the activation of the population. We are methodological, very robust, and we know that each intervention that we do, each research we do is to achieve a better result. And this is for sure. So, Portuguese Society of Health Literacy, we have a site, website, Sociedade Portuguesa de Literacia and Saúde, but I think it's quite easier to arrive to Portuguese Society of Health Literacy and other societies that are also work with us and also do our job on something like similar to what we do. We are not unique, but we are very good what we do.
Does your organization base the network only inside the European Union, or is it open for entire world globally? And
Mhm.
do you
We
have some kind of knowledge exchange?
Yes. We have a group in Angola, Africa, because we have partners from Africa, and I had some students, professional, that came. They are experts in health literacy. I have in Peru, in South America. I have in Brazil also, in the countries with Portuguese language, and we are increased now. We have partners in Serbia, and we have media education center, and we have few right now, two big institutes, big entities in Serbia. This is quite interesting to have Mir, the president for Media Education Center, is quite important also for us and for Serbia and for Europe also.
Okay, so what will be the message for the end of our interview?
Health literacy save lives, quite sure.
So easy and so simple.
Yes, yes.
Thank you very much for your time.
Thank you, Sasha. Thank you.